Wanna pass your NCLEX? Then let's get started. Today we'll cover 10 questions on safety and infection control. Just a side note, according to the NCSBN website, roughly about 13% of the NCLEX exam will contain questions based on this concept. Question 2. A nurse is caring for a client with tuberculosis. Which personal protective equipment is most essential for the nurse to wear when providing care? Gown, gloves, mask, shoe covers. Pause the video and select your answer. If you chose option C, you are correct. Mask. Wearing a mask helps prevent the inhalation of airborne TB particles. Question 3. A nurse is caring for a client who is on contact precautions for methicillin resistant Staphylococcus aureus. Which action is appropriate when entering the client's room? Wearing a gown and gloves, wearing a mask, wearing shoe covers, wearing only gloves. Pause the video and select your answer. If you chose option A, you are correct. Wearing a gown and gloves. Contact precautions require the use of both gown and gloves to prevent the transmission of MRSA. Question 4. A nurse is caring for a client with a central venous catheter. Which action by the nurse is most important for preventing catheter related bloodstream infections? Changing the catheter dressing weekly, using a sterile technique during catheter insertion, flushing the catheter with saline daily, keeping the catheter side dry at all times. Pause the video and select your answer. If you chose option B, you are correct. Using a sterile technique during catheter insertion. Proper sterile technique during insertion is crucial for preventing catheter related bloodstream infections. Question 5. A nurse is preparing to administer medications to multiple clients. Which action is most important for preventing medication errors? Administering medications quickly to ensure timely care, verifying the client's identity using two identifiers, documenting medication administration after the shift, relying solely on memory for medication dosages. Pause the video and select your answer. If you chose option B, you are correct, verifying the client's identity using two identifiers. This helps ensure that medications are administered to the correct client. Question 6. A nurse is caring for a client with a suspected latex allergy. Which of the following items should a nurse avoid using to prevent an allergic reaction? Vinyl gloves, latex free catheters, latex based medical tape, latex free IV tubing. Pause the video and select your answer. If you chose option C, you are correct. Latex based medical tape. Latex allergy can be triggered by exposure to latex proteins found in latex based products like medical tape. Question 7. A nurse is caring for a client with a urinary tract infection. Which action is most effective in preventing the spread of infection to other clients? Placing the client in a private room, using dedicated equipment for the infected client, encouraging frequent hand washing for all staff, administering antibiotics to all clients on the unit. Pause the video and select your answer. If you chose option B, you are correct. Using dedicated equipment for the infected client. This helps prevent cross contamination of equipment between clients. Question 8. A nurse is caring for a client with a draining wound. Which action is most important for preventing the spread of infection? Using sterile gloves when changing the dressing, cleaning the wound with tap water, reusing the same dressing for multiple changes, allowing visitors to touch the wound without gloves. Pause the video and select your answer. If you chose option A, you are correct, using sterile gloves when changing the dressing. Sterile gloves helps prevent contamination of the wound during dressing changes. Question 9. A nurse is caring for a client with pneumonia. Which intervention is most effective for preventing aspiration? Elevating the head of the bed to 30 degrees, administering sedatives to promote relaxation, providing thickened liquids for hydration, encouraging the client to lie flat during meals. Pause the video and select your answer. If you chose option A, you were correct, elevating the head of the bed to 30 degrees. This position helps prevent aspiration by reducing the risk of regurgitation. Question 10. A nurse is caring for a client with a urinary catheter. Which action is most important for preventing catheter associated urinary tract infections? Irrigating the catheter with sterile water daily, securing the catheter tubing to the bed frame, emptying the catheter drainage bag every 12 hours, maintaining a closed urinary drainage system. Pause the video and select your answer. If you chose option D, you are correct, maintaining a closed urinary drainage system. A closed system reduces the risk of contamination and infection. Click that subscribe button and join us next